That went on through the 60s, and in the early 70s, about 1974 as I recall, Dr. Henry Heimlich published a paper suggesting that people who are choking on foreign bodies, that if you just compress the up high in the abdomen, that you could create an artificial cough and expel the foreign body from the throat and the airway. The moment I read that, it was like eureka. We've found it. What a great idea. Because up to that time, trying to probe down in there and get a foreign body out, it was just not, the results were terrible. And anecdotal evidence came along that showed that there were a lot of people's lives being saved with the Heimlich maneuver. By that time, I was serving as a consultant to the American Heart Association Emergency Cardiac Care Committee, that was responsible for setting the standards of CPR, mouth-to-mouth rescue breathing, and closed chest heart compression. And I went to that group, and I said, you know, I think Dr. Heimlich is on to something terrific. One problem. The studies that he did to develop the idea were done on dogs. Now the diameter of the chest, front to back, on a dog is greater than the diameter from side to side. We're just the opposite. We have a shorter distance front to back than we do side to side. So I suggested to this group that a study be done on human volunteers to study the effectiveness of the Heimlich maneuver and get some good recordings of peak airflow, maximum pressure, and total airflow during the Heimlich maneuver. And this group said, Chuck, you need to do it. So with the help of Diane and one of my partners, Dr. Tom Subich, who is a member of Probus, we put together a study at Providence Hospital here in Everett. I got 6 volunteers. We were going to study 2 of them at each session. They would be anesthetized. We'd put a tube, an endotracheal tube, down into their windpipe, and one of the respiratory therapists set up all of the equipment to monitor airflow with these procedures and the pressures that were created inside the airway, and then we'd plug the airway and we'd ventilate the patients, the volunteers, 100% oxygen for a little bit so that we could have them not breathing for a short period of time while we made these measurements. In the process of developing the protocol for this study, it occurred to me that we needed to compare the Heimlich maneuver with an application somewhere else. And the somewhere else, I felt, would be on the chest, to actually compress the chest instead of the abdomen as Dr. Heimlich advocated. I wasn't trying to create anything new. I was simply trying to establish what were the dynamics in the chest to create an artificial cough with the Heimlich maneuver. Well, in order to be sure that I was performing the Heimlich maneuver correctly, I called Dr. Heimlich on the phone and told him what I was up to. And he was excited. He says, absolutely, this is the thing to do, and I'm going to be giving a lecture in Montreal next week, and after the first 2 volunteers that you study, I want you to call me back and tell me the results. What the results were that the compression of the chest was creating greater pressures and airflow than the compression of the abdomen. Totally unexpected. I wasn't trying to prove anything other than make the comparison. Well, I called Dr. Heimlich the next morning and told him about this, and he threw a hissy fit. He says, well, obviously you didn't do the Heimlich maneuver correctly. And he was really angry. we finished the study of 2 volunteers on each of 3 successive evenings, and those studies were, each volunteer was consistent that the application of the maneuver on the chest was more efficient than the maneuver on the abdomen. I reported this work to the American Heart Association, and Henry had beat me there. Henry Heimlich is, I'll have to be careful because it will become evident that I don't have high regard for him. He beat me there and told the Heart Association Emergency Cardiac Care Committee that I had performed, not only had I performed the procedure incorrectly, but that I had conducted unethical medical procedures. I did get the study published in 1976, I believe it was, but by the time it was published, Dr. Heimlich had filed unethical medical procedures against me at both of the Everett hospitals, the Washington State Medical Society, Washington State Society of Anesthesiologists, and the American Society of Anesthesiologists, and the American Medical Association. So with those kinds of accusations, I was called before the boards of the hospitals and grilled pretty extensively about the study. I had permission to do the study by the hospitals. Certainly we weren't doing it hiding out. And Dr. John Bonica at the University of Washington, who was then chairman of the Department of Anesthesia, was designated by the American Medical Association to be the definitive investigator of whether I had conducted unethical medical procedures or not, and whether these charges should be followed up with disciplinary action. When he was through interviewing me about it, he said, "Chuck, had I devised this study, I would have done it exactly the way you did it. However, 6 months ago, the American Medical Association established in their ethics committee that performing studies on human volunteers anesthetized, that were anesthetized for reasons for the study rather than to be anesthetized for surgery or some other medical procedure, for the investigative work alone is no longer ethical." And I must admit that I support that, even though had I done this procedure 2 or 3 years later, I'd have been in deep doo-doo. But I was excused because I was unaware of this passage by the American Medical Association, and they felt that I had been so careful in setting this study up that they did not want to proceed with any proceedings against me. And that was cleared by every single one of the organizations that Dr. Heimlich had filed unethical procedures against me. All this investigation took about 2 years, and I can tell you that life was not pleasant because I had to be interviewed in a rather hostile environment by a lot of people. But I was vindicated, and the American Heart Association seemed very grateful that this study on humans had been done because it needed to be done. Anecdotal evidence of success in resuscitations is always suspect because it's an emotional time, and every anecdote that's described is described by somebody else. Trying to get a good common base of information is difficult. So we passed then from the time when I was vindicated of unethical proceedings to the continued fight by Dr. Heimlich to see to it that it was the Heimlich maneuver and not chest thrust that would be adopted by the Heart Association and the Red Cross to treat choking. And Dr. Heimlich is an interesting fellow. During the Vietnam War, he devised a device called the Heimlich valve, which was put into the chest of soldiers that had chest wounds that we call sucking chest wounds, that every time they take a breath they get air in and it collapsed the lung. So he put in this valve and could re-expand the lung and stop the sucking wound, and a lot of lives were saved because of this innovation. And so he became quite notable in that field. So his name was known, and in addition, he's married to Arthur Murray's daughter. And so he traveled in a realm of knowing a lot of powerful people in Hollywood, and a number of whom made commercials touting the Heimlich maneuver back in the 70s and the 80s. Well, I finally became exhausted from trying to defend the chest thrust as the procedure of choice. We established it here in the state of Washington so that CPR instructors were all taught the chest thrust rather than the abdominal thrust. The Washington State Heart Association bought the idea that my study showed that the chest thrust was better. A colleague of mine in Hawaii felt the same way about it, and so that all the people in Hawaii who were taught CPR were also taught the chest thrust. I then suggested to the Heart Association and the Red Cross that if they were not going to adopt the chest thrust overall as the procedure of choice, that didn't it make sense that pregnant mothers probably shouldn't have their abdomen pushed on real hard to remove a foreign body in the airway, and that the very obese, around whose belly it was difficult to reach in the conscious person who was choking, that maybe at least those two categories ought to it ought to be advocated to apply the chest thrust. I also argued that we already were teaching hand placement for closed chest heart compression, and the hand placement for chest thrust is the same. So that it would simplify teaching and retention of knowledge in treating choking. That met with some approval, but not universal, because it is hard to describe to you the campaign that was waged by Dr. Heimlich to continue to discredit the study that I did and to maintain the Heimlich maneuver as the technique of choice. But he has been quite successful with that for several decades. Fairly recently, in 2000, an investigator in, I believe, Sweden did the same study I did, only on fresh cadavers, people who had just died. And he repeated the study I did and got exactly the same results. And that has refueled attention to chest thrust. And I understand now that both the Red Cross and the Heart Association are leaning more and more. They won't even call it the Heimlich maneuver in their materials. They call it abdominal thrust and chest thrust, which, by the way, was advocated in my original article to use those terms. So it's going to be interesting. I'm happy to talk about the story, but I'm not going to be on the front line fighting for the establishment of chest thrust as the technique of choice, because it seems to me that it sounds too self-serving and that this should come from other people. And I got pretty exhausted back in the 70s and 80s fighting for this, and I don't care to do that anymore. And more people are coming to the front and saying, yes, chest thrust is more effective, easier to learn, easier to remember, and now children, small children and babies, all who are choking, all receive chest compression rather than abdominal compression. About 4 years ago, I began receiving calls from a fellow by the name of Bart Keyes, K-E-Y-E-S. He told me that he was a reporter and a medical investigator, and that he was interested in getting as much information as he could about the development of the Heimlich maneuver and chest thrust. And over a period of a couple of years, I probably received a call from him every 3 or 4 months, and we would visit extensively on the phone, and I would feed him names of people that I knew in the profession who I thought were knowledgeable about the treatment of choking. And a number of years, Dr. Heimlich also advocated the Heimlich maneuver for people who had drowned, saying that the Heimlich maneuver would help get water out of the chest. And that's another whole story, because primarily people who drown do not have much water in their lungs. The vocal cords clamp down, and water, not a lot, the only water that gets into the lungs is after the person is almost dead and the vocal cords begin to relax again, and some water runs down into the chest. But it's not massive in amount. But Dr. Heimlich thinks it is. Anyway, I visited with this chap by the name of Bart Keyes, and he said, Peter Heimlich, who is Dr. Henry Heimlich's son, believes that his dad is a charlatan and is perpetuating misinformation, bad information on the American people. He also has gone into third world countries and infected people with AIDS with malaria, with the idea that malaria, the fever of malaria, would cure AIDS, which every solid medical counsel that I've heard thinks that's a totally cockamamie idea and a terrible perpetuation of malaria on people with AIDS. So he said, Peter Heimlich would like to talk with you. Would you be willing to talk with him? And I said, yeah, I'll talk with Peter. So a couple of weeks later, Peter Heimlich called me, and we had a nice visit, and he began saying things that I couldn't understand, things about my involvement with it that I couldn't understand how he knew, because I hadn't told him. I said, how did you know? I can't remember what the specific thing was, but I said, how did you know that? I haven't told you that. He says, don't you know who I am? And I said, yes, you're Henry's son. He says, well, in addition, I'm Bart Keyes. So he said, what happened was that every time Peter Heimlich would go and try to get records of people who had drowned or people who had been treated by the Heimlich maneuver or chest thrust, a stone wall was thrown in his face because his name was Heimlich. And so the doors kept being shut on him, so he took the pseudonym as a reporter, an investigative reporter of Bart Keyes, and he could get in and get information. Well, ever since then, we've been corresponding as Peter Heimlich. Peter has been pretty instrumental in exposing a lot of his dad's skullduggery, and it's been an interesting saga. It doesn't affect me the way it did in the 70s and 80s. I find it partly amusing and partly very important that he and others continue to expose Dr. Heimlich for the egomaniac that he is. And the sad part for me is that the moment I read his paper on how to treat choking, I thought, this is a terrific idea. And I was supportive of it until we found that the chest thrust was more effective than the abdominal thrust, and began advocating the chest thrust. So, one last little anecdote. I was invited to teach some instructors in CPR in California, in Los Angeles, took a lady who was one of my top CPR instructor trainers here in Seattle. We went down to California and put on this program, and our hosts were hosting us for dinner at a hotel that evening. And we're talking about Dr. Heimlich and all the controversy. This was probably in the early 80s. And we'd been talking about this for about 15 minutes when the voice from the table, 2 tables from us, said, "Well, that's not quite the way it happened." And it was Dr. Heimlich. Now, what the odds were for his being in California at the same time I was and eating at the same restaurant at the same time that I was boggles my mind. We were invited, both of us. I've debated him in open forum on a number of occasions. In the American College of Emergency Room Physicians had their national convention in about 78 or 9 in Las Vegas. There were 500 people in the auditorium, and we were both asked to give our views about the treatment of choking. When that concluded and opened for questions, somebody said, "Well, Dr. Guildner, would you demonstrate the chest thrust?" And the moderator said, "Well, why did you just ask about the demonstration of the chest thrust?" He says, "Well, because it makes more sense to me." And I got up and said, "Sure, I'll demonstrate it, but I think we ought to also demonstrate the abdominal thrust." And the moderator turned to Dr. Heimlich and me, and he said, "Well, would you demonstrate it on each other?" And Dr. Heimlich popped right out of his chair. He says, "Yes." And he came right over to me. He reached around from behind me, and he about cut me in half. So that was the demonstration of the Heimlich maneuver, and the moderator then said, "All right, Dr. Guildner, you demonstrate the chest thrust on Dr. Heimlich." Dr. Heimlich says, "Oh no, he's not touching me." And he refused to reciprocate. So somebody from the audience jumped right up and he says, "Well, you can demonstrate on me." And so that's just another anecdote of my saga of the Heimlich maneuver. And I rather suspect that most people locally didn't have an idea of my involvement with the Heimlich maneuver. I would open to any questions that you may have. Yes, sir.
I was at Aspen, Colorado, about, it must have been 10 or 12 years ago, having dinner at a restaurant, and a fellow choked on a piece of meat and so on, and they came up and they used your thing, and the meat popped right out. And he was,
he's a plant.
Yeah. Have other states now adopted the chest thrust?
Yes, some have. Some do it quietly.
Well, have there been any studies done state to state where they're using the Heimlich maneuver versus the chest thrust?
The American Heart Association put out a letter to every fire department and every emergency caregiver asking for anecdotes, and that study was done in the late 70s or early 80s, and both show effective results. Whether the Heimlich maneuver is so much more widely publicized that many more Heimlich maneuvers came in than did chest thrust. A lot of the chest thrust anecdotes came out of this state because apparently I had a little bit of influence here, and from Hawaii and from other areas too. Will you come up and be my guinea pig? Art Armstrong, the very one. The idea that's so simple is to reach your hands under the armpits and come up under the armpits, grasp your fist, and you can And you want to, I was easy on you. If you'd have been choking, I'd have pulled it a lot harder than that. But you could hear that he couldn't fight it. He grunted. And so it creates an artificial cough. I'm not going to do it on your abdomen because there have been a number of mishaps with the application of the Heimlich maneuver. There have been ruptured spleens and ruptured livers and ruptured stomachs. And so I'm not going to take that risk even in demonstration. There have been some problems with chest thrust. It can break the joint between the breastbone and the ribs. That heals rather well and is not terribly serious. It's uncomfortable, but most of the people who've received it and have had their foreign body removed from their throat would just assume that you had done that. Yeah.
As I recall, when the Heimlich first came out, he was at Cincinnati, wasn't he?
That's correct.
And as I recall, he wanted royalties if the Red Cross was going to use it, and that delayed its adoption for some time period simply because he wanted monetary remuneration.
In all the times that I've been in meetings with Dr. Heimlich and in all the deliberations I'm aware of, he never once asked for royalties. If he did, I'm unaware of it, and I think I'd have known it. It was far more, he did not need the money, he needed the notoriety, and he needed acceptance of the Heimlich maneuver. So I seriously question, I've been in the same room at top-level meetings on this with Dr. Heimlich dozens of times, and I've never heard that. Yes?
Chuck, before the Heimlich maneuver, I was a lifeguard also. And the artificial respiration, as I remember, it was done on the chest.
That's correct. It was called, there was Holger Nielsen, there was arm lift chest pressure, where you pull up on the arms and then push on the back. Or if they were on their back, you do it on the chest. But that was to create breathing. That was not to create a removal of choking.
Right.
Yes?
Physiologically, why is it more efficient to do the chest thrust?
I don't know. I don't know. I could speculate, but somehow it makes more sense to me to be compressing the chest where the lungs are to create that than pressing on an abdomen. What you're doing is forcing abdominal contents up against the diaphragm, and you're really not accomplishing anything with decreasing the space inside the chest other than moving your diaphragm. I suspect that's the reason, but to me it's academic. The studies show that it's more effective on the chest than it is on the abdomen, and that's. I appreciate the question, and I'm not hesitant to answer. I don't know. Yeah.
Okay, one more question.
Yeah, go ahead.
Several years ago, I had a brother-in-law. We were having dinner, and he got something stuck in his throat. I didn't know it, sitting around the table. That he ran like hell out the back door and plopped on the ground face down. The only thing I thought I knew what to do was straddle him, and grab him somewhere there, and pull like hell, and he did. It expelled a piece of carrot. Now, if he's on his stomach, how can do you turn him over and do something with his chest?
No, I get right on their back and apply the pressure. Yeah, or I'll roll them over and get my arms around them, but it doesn't matter much. Just get a lot of pressure on that chest. Yeah, and that's with the conscious person. With the unconscious person, finally goes unconscious. They're going to be either on their back or on their stomach, and you just climb on top and apply pressure.
Would you apply pressure on the back in that case then?
I would. That's chest thrust. Yeah.
Well, thank you, Chuck.
Yeah, you're
Wednesday before Thanksgiving, 21st, we'll have the new Naval Station Everett Commanding Officer here to present the state of Naval Station Everett. And then we have Harry Stuchel and the Barbershop Quartet for December's program. That's December 19th. So looking forward to that. And we'll announce other programs as we get them lined up. Thank you.